Modern life. Between careers, kids, and health, it can be mayhem. That's why we're here. I'm Dr. Lisa Varghese-Kroll.
And I'm Dr. Lonray Falusi. We're physicians, moms, and longtime friends who break it all down for you. Wondering how to juggle all the balls and still stay sane? Looking for advice but don't want to be overwhelmed?
Curious about how to make the most out of life for your family but enjoy it at the same time? You're in the right place. Welcome to Health and Home with the Hippocratic hosts.
On this episode, we're talking about caregivers. It can be devastating when someone you love receives a challenging diagnosis. What are the most important things you can do to help them? And while doing so, how can you make sure your own tank doesn't run dry? Oncologist and researcher Dr. Vu Duong joins us today to share all that and more. Hey everyone, Lisa here, and I'm solo today, but Lonray is definitely here in spirit because today we have a very special guest. Now, when it comes to medical problems, it's usually the patient that gets the most attention from everyone around them, and understandably so. But what about their family members? Caregiving for someone you love can be exhausting and stressful, even though many people look back on the experience as being equal parts pain and privilege. Many, if not most of us, will find ourselves in this role at some point in our lives. So how do we walk through that period with intention, giving our loved one all that they need while avoiding burnout ourselves? Our guest today is Dr. Vu Duong, an associate professor of medicine at the University of Maryland Marlene and Stewart Greenebaum Comprehensive Cancer Center. His clinical focus is in acute leukemias, myelodysplastic syndromes, myeloproliferative neoplasms, and bone marrow failure syndromes. He's been the principal investigator on numerous clinical trials and is an author on over 60 journal publications in the field. In addition to clinical and research activities, he's also heavily involved in the education of fellows, internal medicine residents, and medical students. He received his undergraduate degree in biomedical engineering from Virginia Commonwealth University and his MD from the University of Virginia. He completed his residency training at the University of Virginia and completed his hematology oncology fellowship training at the University of South Florida. He lives in Central Maryland with his wife and 2 children. He is also our dear friend of nearly 30 years. Welcome, Dr. Vu Duong. Hey, Vu.
Hey, Lisa. How are you?
Good. We're so happy to have you here. It's so good to talk to you.
Oh, thanks. Likewise. Happy to be here.
Well, we're going to just jump right into it because you and I, we've talked about this off air, but oncologists, you are uniquely situated. Your specialty, more than most other medical specialties, walks alongside people during some of their hardest experiences. So based on your decades of experience doing that, what do you think are the most important things that people can do to support a loved one who's going through a serious illness?
Yeah, so this is an important question. First of all, I think that having loved ones to support patients, unfortunately, is probably not as common as you would think. I don't know if maybe that's just a part of my practice site, kind of in a more urban center, but it's unfortunately, I see many patients with very little support, and it's very, very difficult, both for the patient, obviously, as well as for the care team. So again, being someone's source of support is a serious and incredibly important position. And of course, it can be a lot of work and it can be very stressful depending on the level of involvement. I personally kind of see it as a couple of different things here. I mean, first of all, I kind of I feel like there's an emotional support, and then there's kind of the very practical side of supporting someone. And I don't think these are really mutually exclusive, and I think you can fulfill both of these roles concurrently. But so just kind of starting with the emotional support. So, kind of the obvious, just being present, right? I think it's kind of literally the non-verbal way of saying I'm here for you, right? So I mean, I see sometimes in the hospital, I walk in and I see, a patient's spouse or their son or daughter by the bedside, and they're not necessarily talking to each other. They're each on the computer, and they may not necessarily be interacting a whole lot with each other, but they're there for each other, and so and the same thing as at a clinic visit. Sometimes I open the door, I knock on the door, I open the door, and same thing. They're each kind of on their phones, they're reading or they're not necessarily talking to each other, but they're there. And so that's kind of that simple presence, I think, is very important.
Mhm.
And I think that kind of going beyond kind of mere presence, the next is just kind of, especially when it's in the hospital and the diagnosis is sudden, is just this idea of kind of listening to the ill patient and that loved one express their feelings. There's a lot of kind of the rhetorical, why did this happen to me? There's sometimes when something like this happens, we call religious clergymen, priests, rabbis, etc., to the bedside, and so kind of praying with the patients. And some patients try to kind of find meaning in their illness, kind of the well, maybe this is a test, or maybe this is a wake up call for me and a reminder for me to appreciate what's important in life. And so I think that that kind of aspect of it is important as a caregiver, and then kind of when appropriate, helping them maintain a good outlook on things. So I think that's the emotional side that I think is important. And then there's kind of the practical side, right? So the actual aspects of the caregiving itself, rides to appointments, for example. So some of my patients unfortunately drive hours to get to Baltimore to see me and to get their care. Coordinating appointments, and then when you're at the appointments, being the extra set of ears during the appointment. We know that in studies that patients hear a pretty small minority of what their physicians tell them, and so kind of having that extra set of ears is really really important. Yeah, and then once they get home, kind of the help with the medications, for example. Which ones do you take? Which ones were recently started? Which ones were stopped? Which doses were changed? Am I on the right dose? What time do I take the dose? And am I supposed to do it on an empty stomach or on a full stomach? Things like that. There's so much that's involved in the nitty gritty as it comes to being a good patient, that having that caregiver there to help with some of those aspects is really really important. And then finally, I think that there's also, of course, a very large financial burden sometimes as it comes to, particularly in my field, cancer care. But I find that usually the immediate caregivers are close enough to the patient that this is kind of a shared burden. And
Mm.
so I think it's harder for caregivers to support each other, to support their loved one in that way, just because, again, it's usually within the same family. So that financial burden is shared.
That's so interesting. One thing that you mentioned, it's true, right? It's quite a privilege to have a caregiver. When you mentioned that a lot of patients don't have someone to be that support system for them at all, I think that's something that we should really be aware of, and is all the more reason for people to maybe step in if you know someone that is not maybe a loved one, but someone that's in your circle and doesn't appear to have that support. Even the slightest little bit may be a big deal to someone that doesn't have that at all. I think that's
Oh,
a really important point.
Oh, absolutely, absolutely. Like I said, sometimes I really struggle. I look at the patient's chart, and then their next of kin or emergency contact is, a niece that is, 3 states away.
Right.
It's really tragic sometimes.
Heartbreaking.
Yeah, absolutely. And
Absolutely.
so, and that's tough. So oftentimes, all of us as healthcare workers, sometimes we try to rally as much as we can around that patient and give the support that we can, since unfortunately there's no one else to do it for them.
Right. How, when you're looking at that situation, how do you feel that caregiving changes when the patient's illness is terminal as opposed to acute or chronic, meaning that it's either it's time limited, the patient is expected to get better, or it's chronic and it's probably not going to get better, but they are going to live with this for a long time. Death is not imminent. How do you think that the needs of patients change when the illness is terminal?
So I guess let me talk a little bit first about, you said, so I know that you said that death is not imminent, but in talking about that, first of all, I guess I'll just talk briefly about just kind of hospice care and such. So when patients enroll in hospice care, the goal is kind of the responsibility for caring for the patient really usually resides with the family, and the idea is to kind of have the patient at home as much as possible. And so the focus really at that point is on symptoms, and sometimes that's a pretty significant transition for a lot of patients and their family members, because for the last several months or last several years, you're worried about what do the labs show, what does the imaging show, what's next, what's the next treatment, and now all of that kind of stops. So I think that's a pretty difficult transition sometimes. So that's definitely different. But also when things become terminal, as patients get older or get more ill just in general, they oftentimes get too sick to really do the activities of daily living, right? So walking,
Mhm.
bathing, showering, eating, dressing themselves, things like that. And so, and once I think patients get that knowledge that this is now terminal, there is a kind of I feel like there's a little bit of a shift. The patient in my experience, tends to become a little bit more spiritual. There's more religion tends to kind of come a little bit more to the forefront. And I think that as a part of that, the caregiver, I think there's a large effort to kind of bring peace to the patient in their final months or so, and also kind of worrying about, once again, some of the more practical aspects of things, wills, obituaries, funeral planning, for example, things like that. And then, I mean, I've seen in some families where, the patient writes their own obituaries, for example. And so,
Wow.
again, something to kind of help the caregiver can help the patient through things like that. Again, as things get a little bit closer to that time, I feel like family and friends start to visit a little bit more often, and so you kind of have to be ready to, as a caregiver, to kind of open up your home to a lot of visitors, and also kind of delivering on any kind of final wishes when feasible. So if there's a special place that the patient wanted to go to before they pass, or a special person that they want to see, or do something that they never found to do, they were never found the time to do previously. That's I think that that's something that oftentimes falls on the caregiver to try to help accomplish in the time that a patient has left, whether it be months or days.
Wow. All good practical points. Some of these things that we don't necessarily think about until we're in the thick of it, writing an obituary, for
Mhm.
example, opening your home to visitors. I think these are really tangible items that are good to keep in mind. We talk about caregiving, right? And we focus on the patient, which is understandable. They're the one going through this massive medical battle. But there's no doubt that caregiving takes a lot out of the caregiver. And if a patient is fortunate enough to have a loved one that is taking on that caregiving role, that caregiver is most likely, at least on some level, willing to do it. But there's no doubt that there has to be some replenishing of their own bucket as well. So how can caregivers make sure that their own tank gets full? How can
Yeah.
they protect their own well-being while doing a good job caring for their loved one?
Yeah, so again, a very important topic. We There are studies that have shown that caregivers are at higher risk of depression and anxiety, mental health suffers, and then even kind of physical health. They're at higher risk of heart attack and death even. And then we
Wow.
also see, yeah, and we've also seen studies that that show that caregivers sometimes have increased consumption of alcohol and substance use
Mhm.
over time and such as well. So again, very important, as you said, to kind of replenish the tank. So there's this caregiver ring theory model, and so this kind of is a model of how support should flow when someone is very ill. And so the center of the ring is the patient, and then immediately after that, it's the caregivers, and which is usually immediate family members, and then kind of beyond that is usually caregivers, friends, and family. That make up the next larger ring. And then afterwards, it's kind of the outer ring is those who are kind of more peripherally involved and are not as emotionally attached to the patient. So the idea is that you offer comfort inwards, and you dump stressors outward, it shouldn't be the other way around. And I think that this is kind of a good way to look at things, and it is, I think, practically in society. I think this is kind of how we do things, right? I mean, for example, if I'm the immediate family member of someone who's really ill, we feel as though it's not really right for us to kind of dump our stress and our feelings on the ill person. And so that person can kind of, can kind of dump on us, but we can't dump on them. And I
Right.
think that makes sense. But I think that this kind of goes along with the idea that caregivers need caregivers as well sometimes. And I
Right.
think that that's one way to kind of help things. I think that just even acknowledging the caregiver burden, whether or not they have symptoms of depression or anxiety or other mental health issues, I think that the caregiver shouldn't be afraid to ask for help and be accepting of help that is offered to them. I think that in addition to that, just the care itself, sometimes having multiple caregivers is a luxury, but it really can relieve some of the burden on the caregiver. Other things that I've seen and just kind of sometimes that I give general advice about is for caregivers to kind of stay organized. So making to-do lists and daily routines kind of helps you get through the day. try to be physically active when possible, and also make sure that you're going to your own health appointments with physicians and such when you can, and getting enough sleep, some of these basic necessities. And then there is also, there are also kind of caregiver support groups and such. Sometimes some of them are virtual, some of them are live. And so these are things that you can participate in. And then I think that lastly, just to kind of relieve some of the burden of stress, sometimes if it's possible, caregivers can take a break from their job if they can. As we all know, there's the Family and Medical Leave Act, and this allows employees to take a few months of unpaid leave to care for loved ones. And then, kind of alongside that, sometimes coworkers, when they're aware that you've got a really sick family member, there's kind of leave donation banks that they can, donate their unused leave to kind of help that caregiver through this time. So I think that all of these are things that you can potentially do. Certainly, it's not easy, and it can be a very stressful job. But hopefully, these are a few things that some caregivers can do to just kind of uh, to stay active and keep their sanity.
I think those are great tips, and I'm really glad you mentioned ring theory, because the other thing is that if you're in the ring outside the caregiver, you shouldn't be dumping on the caregiver, right? Like
Exactly.
you need to be the receptacle for their stress. And I feel like that is not easy sometimes. If you're like a neighbor, right? It's easy to say like, "Oh man, I'm just so worried about Joe. I just don't know how you do it." And that is not helpful according to ring theory. You need to let
Right.
them share with you, and you have to be the strong one. And if it's too much for you, you have to find another outer ring that's one layer out for you to dump on. So I'm really glad that you mentioned that. And I think that those are really practical tips. It's so true. Even just getting enough sleep, or not blowing off your own doctor's appointments. Although it seems kind of daunting in the short term, man, long term it's critical.
Yeah, absolutely. And I think that also kind of going along with that ring theory, you kind of mentioned again this idea of, kind of dumping out and comfort in. I think for those of you, if you're ever kind of on the outer ring and you see a caregiver who's stressed out, I think it's appropriate and certainly very nice to offer to do things for them. So, for example, again, the practical aspects of things, who's watching your children when you're in the hospital or when you're at appointments, right? Who's picking up your dry cleaning, who's preparing your meals. And I think that these are things that people kind of more on the outer rings can kind of help with for the people in the inner rings. And
Yeah,
again,
great
that would, I
point.
think, yeah, I think that would also help a little bit as it comes to caregiver burnout.
Absolutely. So, are there any resources that you recommend for caregivers who are just sort of entering this phase of their lives, or maybe have been doing it for a while?
There are now. I'll admit to you, of course, that a lot of these are kind of specific for the patient population that I see, and so they tends to be a little bit more appropriate for cancer patients. But so the American Cancer Society website, for example, cancer.org, there's a whole section on caregivers and family on their website. And again, even closer to the patient population that I see, the Leukemia Lymphoma Society, so lls.org, has again a whole section on caregiver resources and support. I think that there's some other resources as well that are a little bit more geared towards certain populations. So there's a website called Bright Spot, so brightspotnetwork.org, and this is a little bit more geared towards helping families with children who are affected by family members with cancer. So how do you tell the children? There's little projects that you can do there on all of these websites. Sometimes there's some small financial grants that you can apply for as well to kind of help with. And so those I think are good resources. And then outside of websites and such, just in general, most areas do have support groups for families that are going through cancer and cancer treatment. Locally here, there's a wellness house in Annapolis. There's also the Ullman Foundation that tends to specialize a little bit more towards young patients who are afflicted by cancer. So all of these I think, are pretty good resources to look for.
Oh, fantastic. And we will link to all of those on our website at hippocratichost.com. So thank you so much, Vu. This has just been such a pleasure to chat with you as professionals. But we really appreciate you sharing your expertise, because this is such an important topic. And, none of us really know when our number is going to get called up to be a caregiver. And so to have this at our fingertips when we need it is just really important. And we appreciate you so much.
Yes, thank you so much, Lisa. Thank you so much for having me. And yes, absolutely, it's a pleasure seeing you and talking to you in this more professional capacity as opposed to our usual interactions with each other.
Which is a topic for another episode when Lonray can be here.
Absolutely, right?
Thanks so much to Dr. Vu Duong for joining us today. Check out our show notes at hippocratichost.com for more resources and additional reading on support for patients and their caregivers. Thank you, as always, for listening and for all your support. Please follow us on Facebook, Instagram, and other major social media platforms, and subscribe and review us on Apple Podcasts. Really, this only takes a second. All you have to do is open your podcast app, click on our show title, and scroll down to submit a quick review. That small effort makes such a difference to us, and it helps other people like you find the show. And if you'd like to support us with a monthly donation, just go to our website at hippocratichost.com and click on the Become a Friend of the Show button. We'll be forever grateful. Thanks, everyone, and talk to you soon.
Thanks for listening to Health at Home with the Hippocratic hosts. Remember that all views expressed here are our own, not our employers, and all content is for informational purposes only and should not be construed as medical advice, nor the establishment of a doctor-patient relationship. Always consult your own physician or healthcare team for any medical issues.
If you enjoyed this episode, please rate us, subscribe, and tell a friend. And check out our website at www.hippocratichosts.com for show notes on this and all our episodes. Can't wait to chat with you next time.